Welcome. This is a brief video to review our evidence-based programs quality assurance tool developed by the Nevada Center for Juvenile Justice Innovation. This training will cover the Nevada legislation that outlines the use of evidence-based programs in juvenile justice, define evidence-based programs, and introduce the quality assurance tool, including information on who should use it, how to submit it, and who to contact if you have any questions. Assembly Bill 472 was passed in June of 2017 and codified into law as Nevada Revised Statute 62B.615 to establish policies for reducing recidivism and improving outcomes for youth in the juvenile justice system. Included in the legislation was a requirement that DCFS and county juvenile service departments adopt evidence-based programs. Specifically, juvenile justice programs supported by state funding through DCFS must be evidence-based, research-based, or evidence-informed. We will talk more about those classifications later in this video. The legislation also required the development of the Nevada Center for Juvenile Justice Innovation, an evidence-based resource center designed to support the implementation of evidence-based programs statewide. To learn more about the legislation, you can visit the main page of our website at ncjji.ncjj.org. So, what are evidence-based programs? There's been an increased emphasis and demand placed on the use of evidence-based programs and practices in juvenile justice. Given budget and resource cuts, policymakers and practitioners are being asked to demonstrate programs are effective and produce positive youth outcomes. By using evidence-based programs, system stakeholders can be reasonably assured that the programs are cost-effective and result in positive outcomes. First, let's talk about the term evidence-based. This term is used in many fields, including juvenile justice. To be evidence-based means that a program or practice has been shown to be effective through some level of objective and rigorous research. When agencies implement a program that research shows to be evidence-based, in the way that it was intended to be implemented, they can have confidence that the program or practice will work, that is, that it will achieve the intended outcomes. There are different definitions of evidence-based that vary in the amount of or type of research required and may use different terminology like promising or effective. As part of Assembly Bill 472, the Juvenile Justice Oversight Commission decided on a clear definition of evidence-based for Nevada. That definition is described in this matrix. The Strategic Plan Committee of the Nevada Juvenile Justice Oversight Commission drafted and approved a definition of evidence-based that informs the use of evidence-based programs and practices across Nevada. Nevada's definition of evidence-based categorizes programs based on a continuum of evidence that highlights the best available research. The definition matrix categorizes programs based on two important principles: the strength of the evidence and the level of the effectiveness. For example, we can have strong evidence through rigorous evaluation that a program is effective, while strong research evidence can also tell us that programs may be ineffective or even harmful. The stronger the evidence, the more confident we can be in the results of the research, whether it indicates the program is effective or ineffective. Just because a program has been evaluated doesn't automatically mean it's a good program. Nevada's evidence-based program matrix allows programs to be categorized along a continuum from evidence-based to harmful, with categories of research-based, evidence-informed, and ineffective between the two extremes. The differences between evidence-based, research-based, and evidence-informed are due to the level of effectiveness, type of research design, replication of findings, and the application of findings in other settings. For example, an evidence-based program requires evidence of effectiveness, a randomized control design, and applied studies in two or more different settings. An evidence-informed program is one with some level of effectiveness and may have contradictory finding, uses a single group research design without comparison group, and has no applied studies. Nevada's matrix also includes categories for ineffective and harmful programs. Ineffective programs are those with strong research design that fail to show significant differences between the treatment and the control group, while harmful programs also have strong research design, but findings indicate the program is harmful because the treatment group had worse outcomes than those in the control group. Using multiple categories will help stakeholders understand where a program is on the continuum and what steps it needs to take to move toward a well-supported practice. As you can see, the categories of evidence-based, research-based, and evidence-informed are all eligible for state funding, given they all included some level of effectiveness. Conversely, the categories of ineffective and harmful cannot be supported by state funding. Nevada's evidence-based program matrix is flexible in that it supports the use of programs that underwent repeated rigorous evaluations, as well as those that lack rigorous research but have demonstrated positive effects. The matrix supports the adoption of name-brand proprietary evidence-based programs such as ART, MST, and FFT, while also supporting the use of homegrown, locally developed programs that demonstrate some level of effectiveness. So, where do your programs fit in this matrix? How do you know if your program has research evidence to support its effectiveness? These are important questions to ask that help determine where your program fits in the matrix and if they are eligible for state funding support. The NCJJI developed the evidence-based quality assurance tool to help local juvenile services departments determine where their programs fit within the matrix, and thus if they qualify for state funding. The tool can be downloaded from the NCJJI website. So, who should use this tool? This tool is designed to be completed by those most familiar with the program's design, implementation, and target population. If the program is administered by the probation department or the court, this would likely be probation or court staff. If the program is administered by a community service provider, probation staff may need input from the service provider or perhaps have service provider personnel complete the tool for their program. The tool consists of 13 questions and should take approximately 15 to 20 minutes to complete. What is a program? This question may seem rhetorical, but it's important to define given the variety of interventions that youth participate in as a result of their system involvement. Additionally, the often interchangeable use of the terms evidence-based program and evidence-based practices underscores the need to define what a program is. The Office of Juvenile Justice and Delinquency Prevention defines a program as a planned, coordinated group of activities and processes designed to achieve a specific purpose. A program should have specified procedures, such as a defined curriculum, an explicit number of treatment or service hours, and an optimal length of treatment to ensure the program is implemented with fidelity to its model. It may have, but does not necessarily need, a brand name, such as aggression replacement training or family functional therapy, and may be implemented at a single or multiple locations. Which programs should the tool be completed for? State statute requires departments of juvenile services whose population is less than 100,000 be evaluated for compliance with evidence-based programs and services as described in the evidence-based practices definition matrix. In order to satisfy these requirements, this tool is required to be completed for any programs that are supported by Nevada state or block grant funding. For local programs not supported by these funds, the tool is still helpful to determine the program's evidence of effectiveness and will help create a registry of evidence-based programming across Nevada. Programming administered within a DCF placement is not subject to this process. The Quality Assurance tool can be downloaded from the NCJJI website by first selecting EBP Quality Assurance Tool in the middle of the top banner, and then clicking the image of the tool. Page 1 introduces the tool, explains who should use it, defines what a program is, and gives guidance on which programs to evaluate with this tool. Page 2 gathers contact information from the individual completing the form and information about the program itself. You may need to check the federal and state repositories of evidence-based programs to answer questions 3 and 4. Question 5 helps provide an overview of the program and what it's intended to do and for which population of youth. Page 3 seeks information about any previous evaluations of the program that may have identified the program's effectiveness and the risk level of the youth served by the program. Questions 8 through 10 address the program's characteristics, including its use of therapeutic techniques, whether data exists that describes the program's performance, and the availability of written implementation guidance. Some of these questions may seem complex. If you have questions while completing any portion of the tool, feel free to contact NCJJI staff. Page 4 includes questions about the program's implementation and whether there's a protocol and any monitoring of the protocol to ensure the program is being delivered as designed. The last page displays the evidence-based practices definition matrix as a reminder of how programs in Nevada will be categorized. After you have filled out the tool in its entirety, send it directly to the NCJJI team via email at ncjji@ncjfcj.org. Once the team receives your submission, we will review the tool and reach out to the program contacts as necessary to get any additional information needed to classify the program. Once all information is obtained and we have made our classification determination, we will notify the program contact of our decision. If the program is indicated to be evidence-based, it will also be added to NCJJI's database, which can be found on the Evidence-Based Programs and Practices page of the website. By completing and submitting this form for your juvenile justice programs, you are helping build knowledge about existing programs across the state of Nevada and ultimately ensuring youth and families have access to programs that effectively meet their needs. Thank you for your continued commitment and service to the children and families involved in the juvenile justice system in Nevada, and your efforts to improve awareness and understanding of the programs and services available for them. If you have any questions about the Quality Assurance tool or the services that the Nevada Center for Juvenile Justice Innovation can provide, please use the Contact Us tab on the NCJJI website. Stay connected with the NCJJI by signing up to receive announcements about new content, upcoming trainings, and opportunities on our website.